Have you ever found yourself in a private moment, maybe stepping out of the shower or getting dressed in the morning, and noticed something that made your heart sink just a little? Maybe things don't look quite as full as they used to. Maybe the response isn't as quick or as strong. And maybe, just maybe, you've started telling yourself a story that sounds something like this. I'm getting older. This is normal. There's nothing I can do about it. This part of my life is probably just over. I need you to stop right there, because that story, as common as it is not the whole truth. What if I told you that one of the most underrated tools for improving blood flow, restoring fullness, and bringing back that reliable response doesn't come from a pharmacy, doesn't require a prescription, and isn't hidden behind some expensive supplement with a celebrity endorsement? What if I told you it's probably already sitting in your pantry right now, tucked away next to your salt and sugar? I'm talking about baking soda, plain, everyday sodium bicarbonate. Now, I know what you're thinking. Doctor, are you seriously telling me that the same stuff I use to clean my oven is supposed to help me down there? I get it. It sounds strange. But stick with me, because what I'm about to show you is grounded in real science, real physiology, and real results that men in their 60s, 70s, and beyond are experiencing every single day. In this video, I'm going to walk you through 5 powerful, clinically supported ways that bicarbonate can help restore circulation, improve vascular responsiveness, and yes, even support size, firmness, and confidence. If you've been feeling like your body is betraying you, like your best years are behind you, I want you to know something important. You are not broken. In most cases, what you're experiencing isn't permanent damage. It's blocked circulation. Think of it like a clogged drain, not a broken pipe. Before we dive in, do me a quick favor. Drop a comment below and let me know where you're watching from. We've got men tuning in from every corner of the globe, and knowing you're not alone in this journey makes all the difference. And if you believe men deserve honest, shame-free health information that actually works, go ahead and hit that like button. It helps this message reach men who are struggling in silence and think they're the only ones. My name is Dr. Jocelyn Carter. I'm a board-certified urologist, and for over 10 years, I've been working exclusively with men over 50, 60, and 70 to protect their prostate health, restore their sexual wellness, and reclaim their vitality. Everything I share in this video is educational, evidence-based, and meant to support the care you're already getting from your own doctor. Now let's tackle a dangerous lie that too many men believe. There's this widespread idea that once you hit 65 or 70, your body just naturally gives up. That shrinkage is inevitable. That weakness is permanent. That decline is just part of getting old. And while yes, aging does bring changes, that belief is not only incomplete, it's often flat out wrong. Here's what's really happening in most cases. What looks like permanent loss is actually restricted blood flow. Picture your blood vessels like a garden hose. Over the years, inflammation, oxidative damage, and internal acidity cause those vessels to stiffen and narrow. It's like someone stepped on the hose. The pressure drops, the flow weakens, tissue looks smaller, responsiveness fades. But here's the key. The hose itself is still there. It doesn't need to be replaced. It needs to be opened back up. And that's exactly where bicarbonate comes in. This isn't about gimmicks or magic pills. This is about creating the right internal conditions so your body and any medications you're taking can actually do their job. Let's start with something most men have never heard of. Your skin isn't a solid wall. It's semi-permeable, which means things can pass through it under the right conditions. When the tissue in that area becomes acidic and inflamed, elasticity decreases. Blood vessels underneath struggle to expand. But when you use a gentle alkaline soak, you shift the pH balance in that tissue. Inflammation goes down, microcirculation improves, elasticity returns, blood volume increases naturally. It's like loosening a tight belt around a balloon. Suddenly, it can inflate again. Here's how you do it. Take 2 tablespoons of aluminum-free baking soda and dissolve it in warm water. Soak for 10 to 15 minutes, 2 or 3 times a week. Make sure there's no broken skin or active irritation. Rinse thoroughly when you're done and use a gentle moisturizer if your skin feels dry afterward. What men report from this is surprising. It's not just physical change, it's mental relief. When the tissue looks healthier and starts responding better, confidence quietly comes back. You start believing in your body again. Here's something else that happens as we age that almost no one talks about. Your kidneys slow down. They don't filter waste as efficiently as they used to. This leads to something called low-grade metabolic acidosis, a fancy term for a slightly acidic bloodstream. And acidic blood does something very specific. It tightens your blood vessels. Bicarbonate works as a buffer. It gently shifts your internal pH back toward balance. And when that happens, the smooth muscle tissue in your blood vessels relaxes. Relaxed vessels mean better flow, better volume, and better performance. Here's the protocol. Take half a teaspoon of baking soda in 8 ounces of water first thing in the morning on an empty stomach. Yes, it tastes a little salty. You can add a squeeze of lemon to make it easier to drink. If you have high blood pressure or you're on a sodium-restricted diet, check with your doctor first. Men describe this feeling as waking up, like something that was stuck finally starts moving again. Now, before I show you the next method, we need to talk about why so many men are doing everything right and still not seeing results. A lot of you watching this video are not sitting around doing nothing. You've tried the supplements, you've taken the nitric oxide boosters, the beet powders, the L-arginine, the L-citrulline. Maybe you've even been prescribed medication, and yet the results feel weak, inconsistent, or short-lived. That's not because those things don't work. It's because they need the right environment to work in. Let me explain. Nitric oxide is the key molecule that tells your blood vessels to relax and open up. But here's the problem. Nitric oxide is extremely fragile. In an acidic, inflamed bloodstream, it breaks down almost instantly. It's like trying to start a fire in the rain. Bicarbonate doesn't produce nitric oxide, but it protects it. By buffering acidity and reducing oxidative stress, bicarbonate allows nitric oxide to stay active longer. Instead of brief spikes followed by rapid crashes, you get sustained dilation, better volume, and more reliable performance. Here's the timing trick. Take your bicarbonate drink 20 to 30 minutes before you eat nitric oxide boosting foods or take your supplements. Think of bicarbonate as setting the stage so the show can actually happen. Now let's talk about something called inflammaging. It's a real term, and it describes chronic, low-level inflammation that builds up over decades. This isn't the kind of inflammation that causes sharp pain. It's silent. But over time, it changes your tissue structure, leading to fibrosis, which is basically stiff, non-elastic tissue. Even if blood flow improves, fibrotic tissue can't expand properly. Bicarbonate has been shown in studies to reduce inflammatory markers like C-reactive protein. When inflammation drops, tissue becomes more elastic again. Expansion capacity returns, comfort improves, performance stabilizes. Here's the best way to use it for this purpose. Take 1/4 teaspoon daily for 5 days, then take 2 days off. This keeps your body's natural buffering system in balance without overriding it. And here's something powerful that happens when your body starts responding predictably again. That fear you've been carrying, that anxiety before intimate moments, it starts to fade. Your body stops feeling like an enemy and starts feeling like a partner. One of the smartest ways to use bicarbonate is to combine it with lemon. Here's the recipe. 8 ounces of filtered water, 1/4 teaspoon of baking soda, and the juice of half to 1 fresh lemon. Drink this 20 minutes before breakfast. Why does this combination work so well? The potassium in lemon balances the sodium in baking soda. The citrate enhances alkalinity. The bicarbonate buffers acidity. Together, they create a powerful internal reset. Men who use this consistently report better morning responsiveness, more reliable performance throughout the day, and an overall sense of vitality. And here's the deeper benefit. Starting your day this way sends a message to your brain. I matter. My health matters. My vitality matters. That mindset shift often leads to better food choices, more movement, better sleep, and more self-respect. And all of those things compound over time. Now let's make this practical. Here's your 30-day challenge. For the first 14 days, focus only on the morning drink. That's it. Don't overcomplicate it. Don't try to stack 5 things at once. Just commit to the drink every morning. Think of this phase as clearing the pipes. From day 15 to day 30, keep the morning drink going and add the soak twice a week. This is when internal improvements start showing up as visible physical responsiveness. If you only do one thing from this entire video, make it the morning drink. That internal pH shift is the most powerful lever you can pull for vascular health. Everything else builds on top of it. Now let's set realistic expectations. You're not going to wake up tomorrow with the body of a 25-year-old. That's not how this works. And chasing that fantasy will only leave you frustrated. What most men notice instead is this: increased warmth in the area, a fuller feeling, better morning responsiveness, less anxiety before intimate moments, and more consistent, reliable performance. That's what success looks like. And that success matters because it's not just about physical function. It's about confidence. It's about dignity. It's about feeling like yourself again. Too many men suffer in silence because they think this topic is embarrassing or shameful. It's not. It's biology, it's health, and it deserves to be talked about openly and honestly. So here's what I want you to do. Drop a comment below and tell me which step you're going to start with. Hit that like button so this video can reach other men who need it but don't know where to look. Subscribe to this channel for weekly evidence-based strategies that actually work. And if you know one man who might benefit from this but won't ask for help, share this video with him. Aging doesn't mean giving up. It doesn't mean surrendering. It means adapting, optimizing, and taking control of what you can control. I'm Dr. Emily Carter, and I want you to remember this: vitality isn't something you lose and never get back. It's something you practice every single day.